today. Good morning. We are here with dietitian Garima Pallavi. We are Heart Health India Foundation, and today we are having a discussion on the topic Your Diet Can Prevent Heart Diseases. So, we have with us an experienced dietitian today. She has more than 10 years of experience, and she is an anchor. She has conducted webinars and seminars in the past, and she also conducts many other awareness programs. She herself founded an NGO back in college. So, this is part of Heart Health India Foundation, and we would like to give a brief introduction about Heart Health India Foundation. Um, so, yes, is my screen visible, ma'am?
Yes.
Yeah. So, Heart Health India Foundation, it's the first patient-led organization working on cardiovascular diseases in India. So it was started back in 2020 by Mr. Ram Khandelwal. He himself is a young heart attack survivor, and it was co-founded by his wife Aditi Khandelwal. And it began as a very small group on the Facebook. Now it has been established as a foundation with over 300 volunteers. So what does Heart Health India Foundation do? It basically spreads awareness, has support systems, and advocates for the needs of patients. Moreover, they provide a wide range of services, like they have support groups, counseling services, educational workshops. It has awareness campaigns, like it conducted a run for heart health back in Mumbai, health screenings, CPR trainings, corporate wellness, collaborative research, and resource distribution. So our founders, as mentioned earlier, are Ram Khandelwal and Aditi Khandelwal. And we have partners, that is Dr. Virendra Sarwal and Dr. Johan Christopher. So this is about Heart Health India Foundation. And over to you, ma'am, for a brief introduction about yourself.
Yeah, thank you so much, Calvin. So I think you already gave a good introduction about me, nothing left, but yes. So I have done my graduation in clinical nutrition and dietetics, and I'm mastered in food and nutrition science, as well as I'm master in rural health development. So I think since starting itself, for me, like along with my work, because I started working since 2014, right? So that's how I have 10 years of experience, but that was just after my graduation. So for me, it was the attitude was never stopping, like you should not never stop yourself from learning. And in the current generation, when it comes to health, when it comes to diet, every day we get to know about a new thing coming in the market, that this is very good, that is very good. And whenever we meet a patient, they will ask that हमने Google पे ये पढ़ा, right? So that definitely we have to be prepared to answer our patients in the correct way, that okay, whatever you have read, but not everything is right. Not every time Google is right. Google is right when it gives you the initial information, but when it comes to a depth, you should always reach out to the health partner, health, like your dietitian, your doctors, any health professional, because that is actually the right way to approach for your health. Because like if we talk about doing that way, so like you can even assume that you have a cancer just by seeing a, like tiny pimple not getting recovered on time. That's happened. We don't even see that that could be because we are eating sugar every day, and we are not avoiding such certain things in our diet which can actually helps us recover. But because it is getting somewhere, like in your body, and it's not recovering on time, we feel like it can lead to cancer. It not doesn't happen every time, right? So that's why I believe that we as a health professional have to be prepared every time. So other than my masters, I have done certification in diabetes educator. I have done certification in vitiligo. That's an autoimmune disorder which actually starts from a very early age for the child itself. Actually, it is a new, like you can see it newborn babies as well. So it's a white spot all over the body, and for some, it is so much in deep that it is actually the whole body's skin color is something different from what we in general have. Another thing is I have also done a 6 months diploma course in psychological counseling. So as a health professional, I believe that definitely there are psychologists in country and we can refer our patient to them. But for me, doing a psychological counseling was important so that I understand where my patient is coming from and so that I can help them better. Definitely, when it comes to a depth counseling, a proper psychologist is someone who can help. But yeah, little information about psychology definitely help me help my patients very, very well. And other than that, I have done a research on cancer. So whatever chemotherapy medicines we use in cancer during cancer treatment, so there's a lot of side effects happening. We see that a hair fall is there, then teeth getting black, or we are having some kind of irritation in stomach and gut related issues. So there's a lot of side effects which happens because of the medicine. So I believe that when we see that people dying of cancer, um, if it is early stage, I think it can also be because of the chemotherapy medicine, because not all body is well prepared for the medicines we have. And when we actually take care of our body properly with proper nutrition, we can heal ourselves, right? So that, as I said, I never stop. So other than these, I keep on learning whenever I get a patient and I think that this is something new I'm getting, so I read about it. I do a detail reading about it and then get to the point. So yeah, that's about me. Thank you so much, Calvin.
Yeah, ma'am. So we are really happy to host you. Very well-read person, updated person. So really
Thank
happy
you.
to host you, ma'am. So the first question related to our
Yeah.
topic, that your diet can prevent heart diseases. Let me start off with the question that what are some common dietary habits that actually increase the risk of heart disease?
So, definitely nowadays, if we see the kind of food we are having, like earlier, whatever food, like if I say earlier, so I meant to say at our grandfather's time, right? So at that time, whatever food we used to have, it was very organic. It used to come from the farm and we, wash it, make it, have it. That's all. Now there's a lot of options in the market to eat, and also, like, as we young people, I'm talking about me myself as well. So as young people, we tend to get tempted to eat certain food, of course, because those are made for eating, of course, right? So I never say that as a dietitian, I never strict someone that don't have it. But for me, I would say ki everything in a controlled manner is good, keeping in mind that whatever health issue we have, it can be because of the deposits made of fat, cholesterol, and minerals built up in your arteries, which actually restrict the blood flow to your heart. And that actually increases the risk of getting hypertension or cholesterol increase and eventually heart attack. So yes, diet which is high in processed food, unhealthy fat, refined carbohydrate, or too much of added sugar to it, which is not good for health eventually, because when you are having high sugar, you are getting your blood sugar levels increase, and then eventually some or the other way it gets loaded on your heart as well. So I think definitely we have to make sure that whatever we eat as a balanced diet, um, because nowadays the balanced diet concept is not there. We all studied in, I think we all studied, Kelvin, you will agree with me that in the fifth, sixth standard, we studied about balanced diet. At that time, we didn't know what it is, but that is what we learned, right? That there should be equivalent proportion of everything which is needed on the plate, like protein, carbohydrate, fat, vitamins, minerals, because anything, any kind of deficiency can lead to something very deadly diseases or disorders. So yeah, that I would say that we have to make sure that these are the things like unhealthy fats, sodium specifically, refined carbohydrate, or we can say added sugar, aren't good for our healthy heart.
Understood, ma'am. Understood. So, um, as you said, it actually blocks your arteries and so on. And
Yes.
in that case, which nutrients are particularly beneficial for maintaining this heart health in that case?
Right. So when we talk about nutrients, there's a lots of things which is very good. So when we say that the food we eat can actually influence heart disease risk factors, which actually I will start this with this briefing so that it is connecting. So the basically heart disease risk factors are including high blood pressure, triglyceride, cholesterol levels, and inflammation. So there's a lots of food and which is having some nutrients. So when we talk about, let's say some, let's start with the basic, that is green leafy vegetables. So in particularly, they are the great source of vitamin K, which actually helps protect your arteries and promote promote proper blood clotting. So they are also very high in dietary nitrates. So they have we have seen this in like I have seen in my career that when we include food rich in nitrates, we have seen to reduce blood pressure, decrease arterial stiffness, that stiffness which is there in our arteries, that reduces, and improves function of cell lining the blood vessel. Also, like in a recent, I was reading some article wherein I found that AHA, that's American Heart Association, also have noted that an increased leafy grain vegetables intake was associated with significant benefit in cardiovascular health. When we are talking about green leafy vegetable, other than that also, so for example, beetroot, it also have nitrate. So basically, it increases the VO2 max. So it is very very beneficial for people who are into very rigorous exercises. So when like our heartbeat is having a particular kind of flow, that is what, when the blood flow is there, so that is what we have the heartbeat, lap dub, right? So when we run, then the heartbeat is faster. But are the nutrients being able to reach to all the body part? Because that is not actual function. So that, because the, if you see, whatever the whatever blood that actually flows is carrying the nutrients, and the nerves we have, veins we have, that's a very thin. So to increase the flow and increase the flow so that it reaches the body part on time, it is very important that you include nitrate rich food, because it expands the blood vessels to help flow the blood properly throughout the body. So that is one thing. Next is whole grain. We all have whole grain in our diet. I think especially the Indians, we can't just be without wheat rice, right? So that is very very good. So the common type of grains we use in our daily life is like whole grain. And something which I would like to say, okay, heart health, it is good to have brown rice, oats, rye, okay, barley, buckwheat, quinoa. So these are some grains which are very very good. So that is also very because these are having like, it makes sure that we have to make sure that we read the ingredients when we are buying any kind of grains, because eating whole grains rather than the refined grains daily can reduce your risk for any kind of heart issue. Nowadays there's a lot of refined grains are there. We read about it that multigrain, but are they actually multigrain? No, they are not. And when we see when we get the packaged atta, if you talk about atta itself, when we get the packaged atta, you see it's very soft, very soft. But when the same we get it done, like we use that sabarmati wheat and we get it done ourselves, we get it grinded ourselves in front of our eyes, that's very thick, right? So that is the difference. Actual wheat flour is actually thick because it's having the fiber, the husk, okay? But the packet atta is not having the husk. So some or the other way, that is actually the refined form of the grains, so that it stays longer. All right. So next is the berries. We don't get berries very often in India, but strawberry is something we are getting in, I think, everywhere. Not only in the metro cities, but in now generation, we are getting strawberries everywhere. And strawberries, blueberries, blackberries, raspberries, the all kind of berries for that matter are very, very rich in antioxidants, especially gooseberries. Okay, amla, that's very, very rich in antioxidants like anthocyanins, which protects our body, our cells against oxidative stress and inflammation, which actually contribute for the development of heart disease. So what is whatever oxidative stress we have? So basically what happens, there's something called as free radicals in our body. So if we talk about like positive and negative, so in let's say that this is our cell, this circle is our cell, and in that we have radicals, positive and negative. And in the positive we have like 50 positive radicals and 100 of negative radicals. Okay, so the 50 positive and 50 negative combines, so they are pair, so they are good. But the rest of the 50 negative radicals are actually alone, and that's how they are creating nonsense in our body. That happens, no, in our current generation also. The single people are actually alone and they don't know what to do. So similarly in our body, the negative the free radicals are actually something which creates the oxidative stress in our body, which leads to inflammation, eventually risking your heart, right? So that is there. So berries is there. So basically three nutrient which we talked about as of now is, number one is vitamin K, number two is antioxidant, number three was eating pure grains rather than refined. Okay, now then next is we also have monounsaturated fats. Okay, so that we get it avocados. So that is very, very good for your body. But I can understand not avocados, like avocados we can't get everywhere. But yes, fatty fish for people who are non-vegetarians or people who actually are fishitarian, eat fish. So fish like freshwater fish like rohu, katla, and if you get salmon in your city, then it's the best thing. The higher that it is loaded with omega-3 fatty acids, which have been studied extensively for their heart health benefits. Omega-3 fatty acids are basically from the fatty fish and have a protective role in risk of developing heart disease and slightly reduce the risk of CVD events. Okay, so that's why I would say that fatty fish are also very good. In fact, for people who don't actually get good omega-3 fish around you, then you can also try having fish uh, oil supplements. When I'm talking about omega-3, there is another part. Along with omega-3, walnut is also rich in fiber and micronutrients like magnesium, copper, and manganese. So we always suggest our patient to have walnut at night. Two benefits, because when we sleep, when we go to bed, so basically walnut, because of presence of magnesium, the basic uh, role of magnesium is that it calms your muscles. Okay, so whatever inflammation is there in your brain muscles or heart muscles, it actually reduces that. And research have shows that incorporating a few servings of walnuts into your diet can help protect against heart disease. Okay, it actually decreases the low density, like lipoprotein, that is the bad cholesterol, and the total increased level of cholesterol, and by increasing the good cholesterol, that is the high density lipoprotein, HDL. Okay, next is beans. So beans and legumes again. So basically beans and legumes contains a resistant starch which resists digestion and is fermented by the beneficial bacteria in your gut. We often see, and I think rajma chawal is very, very famous because rajma takes a lot of time for digestion, right? And it takes like about 4.5 hours, and until it is get digested properly, it gives you a little bit of bloating, right? Flatulence. Reason, because it contains resistant starch. Takes time for the digestion. So that is why it has the potential exert, which basically potentially exert a healthy impact on our gut and certain members of the resistant microbiota as well. So that is also very, very helpful. Then we come to antioxidant, that is flavonoids, which boost heart health. So basically, when we talk about flavonoid, dark chocolate is the best. Okay, so I think by hearing dark chocolate, everyone will have a smile on their face. Of course, I'm talking about chocolates. No one is there who will say I don't like it. Everyone loves it. But dark chocolate is like at least 70% plus dark, not like 50% dark, because 50% dark chocolate means 50% sugar. So when you're choosing your dark chocolate, make sure that it is 70 to 75% plus. Okay. Next is tomatoes, easily available in every household, very rich in lycopene, which is a natural plant pigment with powerful antioxidant properties. It actually helps to neutralize the harmful free radicals. We just talked about free radicals, right? So it actually helps prevent the free radicals, which leads to preventing oxidative damage and inflammation, eventually contribute to healthy heart. So there's a lot more, and then we have nutrient dense, as we talked about walnuts. So along with walnuts, there are other nuts like almonds, pistachios. They are also good with monounsaturated fats and fibers, which is very important in heart health. Other seeds like chia seeds, flax seeds, hemp seeds, they are also very rich in omega-3 fats. Now there is something, garlic. We since starting, I think since our childhood, our elders have also taught us that garlic is very good, and we can use it as a potent medicinal properties that actually helps us improving heart health. So basically, it contains allicin, which is believed to have therapeutic effect on our body. So even while I was doing the research on the cancer, I have seen this in the researchers also, that because of the presence of the allicin, and there's a lot of trials done on the garlic and then the garlic supplements, which actually shown that it actually helps in lowering both systolic and diastolic blood pressure. So basically, when we talk about blood pressure, 120, which is the above, is systolic, and 80 is the diastolic. Even in most of the events, when it comes to high blood pressure, we have seen that the diastolic going higher. So diastolic levels going 90 plus is mild hypertension, going 110 plus is moderate hypertension, going 120 plus is severe hypertension, and a call need to be taken. Very important. I would say forget about 120. Even if it touches 150, please reach out to your doctor or your health professional and seek help. It's very important. Next is when it comes to oil, we have different oil. We have olive oil, we have rice bran oil, sunflower oil, but olive oil is packed with antioxidant again. So that also helps in reducing the heart, like reducing the inflammation and increases heart health. Next is green tea. It is very good kind of, it increases fat burning, and that how improve the insulin sensitivity. It contains polyphenols and catechins, which acts as an antioxidant to prevent cell damage, reduces inflammation, and protect the health of your heart. So there's a lot of things, lot of food items I have told you right now, which are good for your heart. But when we are talking about this, very important, we have to make it in a balance. Not like we have everything in the same day. You can distribute your days, right? That there should be presence of the omega-3. So when we talk about nuts, one day you have walnut, next day you have almond, next day you have pistachios, so like that. So I think I gave the answer, Kelvin.
Yes, ma'am, that was a very comprehensive answer. And as you suggested, as you mentioned at the end, you gave a lot of examples of healthy foods, but it's very important to have it in a balanced diet, right?
Correct.
Uh, in your opinion, as a person, I would hear many different opinions or many different suggestions. How do I actually create a balanced diet? Or I'm just expecting a short answer like, How do I actually follow a balanced diet? How do I chart my diet in that case?
Okay. Okay. So when we talk about a balanced diet, the presence of protein, carbohydrate, fat, fiber, vitamins, minerals is very, very important because all of them collectively gives us energy. Okay. So let's take an example of our lunch. So in India, most of the people would have either roti or rice in their lunch, right? So we can have it this way, that we can have one katori, that is 100 to 150 gram, the dinner bowl, right? So one katori of dal, one katori of sabzi, one katori of curd, okay, or a raita, and the rice or the roti quantity should be, like, if you're having roti, maximum two, not more than that. If you're having rice, that should be not more than one katori again. And the one katori which I'm talking about, if we measure it, it is coming around 100 to 120 gram. Okay. So when I'm talking about protein, fat, carbs, so we can see here the carbohydrate source is completely the roti or the rice. The dal gives us protein. Dahi again gives us protein, but it is very good in probiotics, so helps us with digestion. All right. The vegetables which we are including with, it would be a green vegetable, so leafy green vegetable or any green vegetable. When we take it, there's a lot of vitamins and minerals in it. Okay, so that has been taken care of. And when we are using that curd in the form of raita, or we are having a salad as a side, that is taking care of the fiber. And when we talk about fat, so whatever oil is taken for the preparation of this food is what we have as fat. And every food has a little bit of fat as well. So curd also have a very good amount of fat, and it is in healthy fat. Yeah.
Understood, ma'am. But so another thing you mentioned in the previous discussion was we need to ensure that when you buy dark chocolate or atta, we need to ensure that it is actually multigrain, it's actually dark chocolate, and what percent it constitutes. Can you give us some kind of a tip or some help in reading labels?
Okay, so when we go out and we are seeing the labels, there's a lot of things in our packet when we are buying the food. So there are some common things which will be there. We have to make sure that the healthy heart label is given to foods that fall within a set of guidelines which is set by Food and Drug Administration, that is FDA. And for an item to be labeled as healthy heart, we must have these things. The number one is total fat should be less than 6.5 gram. I repeat, it should be less than 6.5 gram. Saturated fat, among those total fat, we have a description. So in that, saturated fat should be 1 gram or less, and 15% or less calorie from saturated fat. uh, Trans fat, it should be less than 0.5 gram. Okay. That is also, you have to make sure that you check per serving, because the package will might be for 1 kg, but we are talking about per serving. Okay, that what you will have as a, one person will have. Then another thing is cholesterol. It should be 20 mg or lesser. Sodium, one of four sodium limits applies depending on the particular food category. So up to 140 mg, 240 mg, 360 mg per level serving is actually suggested. So if we talk about normal food like grains and all, that is fine. But when you are having something like a, I definitely ask not to have packaged food. But in case if you're having a packet of chips, you have to make sure that the sodium levels is not above 140. Okay. Next is beneficial nutrients, that is 10% or more of the daily value. One of six nutrient, that is vitamin A, vitamin C, iron, calcium, protein, or dietary fiber. These things should be mentioned in the food level, that these things are present. Then only you should buy. If these whatever categories I have told you, if any of this is up or low, then I would suggest that we should think about it.
Yes, ma'am, definitely. That was helpful, ma'am. So another thing. So why are we seeing an increase in heart diseases in people younger than 30 years?
Right. So of course nowadays this we all see that people are getting heart attacks in, like, early age. So there's a lot of reason behind it. What I believe, when it comes to me, I always believe that this one very important factor is today's generation is the stress. There's a lot of people that we are we are not able to take that pressure. We are not having the balance of professional and personal life, tending to young generation, increasing their heart risk. It's like giving invitation by smoking cigarettes, okay, by having alcohol. So if smoking, I would say a big no to smoking. Alcohol, I do understand that a lot of people nowadays, you cannot say no because they're already doing it, right? So occasionally, once in 3 months, once in 6 months, in a small peg if they're having, and that too checking the labels, that there should be very less sugar and alcohol content should be also less. In that case, if they're having, then it's still fine. But a person who's having regular alcohol, regular smoking, that too smoking 1 pack a day or more, than doubles your risk of heart disease. Okay. So we have to be very particular about here, that what are we doing, what are we eating, what are we taking inside is very important. And the second thing is, what are we, like you know burning out is also very important. So when we talk about heart attack stats, so as per the recent statistics, so cardiovascular disease remains the leading cause of death in US. In India also now it is very high. We have recently been, just 2 days before, I heard from a friend of mine that a defense person, like the person was working for defense, very fit, got heart attack. So the thing is that the average age for the first heart attack, like normally, was 65 for men and 72 for women, but nowadays it has been changed. It's like a person who is 30-year-old, 32-year-old are actually having heart attack, and the only cause which I have observed is substance abuse or excessive alcohol use, smoking, high blood pressure because of the change of lifestyle, high cholesterol levels again, so the lack of physical activity, diabetes, poor diet. So I think most of it is the lifestyle that is actually causing heart attack. Obesity. So if we see that it runs in the family, if your father and mother is been on an overweight side, make sure that you make your diet and physical activity being regular. Once your diet and workout is regular, then definitely we can avoid having heart attacks. Yeah.
Okay, ma'am, understood. So how can actually these young adults um, balance convenience and health eating, because they are very busy, they are just starting out their professional career, so they are really hustling, trying to earn money, trying to make a living for themselves. So in their busy schedule, uh,
Hmm.
they may not be able to cook, they may not be able to cut fruits and vegetables, have a balanced diet. They might just order it from outside. So even ordering it from outside, they might label it as healthy organic food or something. But when you actually get cooked food from your online food partners, there is no labels for it. They just send the food in. So in
Right.
this busy time, when they are very busy, how do you suggest they can manage a healthy diet?
Right. So, Calvin, I always promote home food, but definitely in the current situation, I would not say that I'm also 24/7 on home food. So, mostly I'm at home food, but whenever I'm going out, I'm traveling for any seminars, or I'm going for any kind of, corporate meetings, then definitely I also tend to have food outside. But there, choices are very, very important. First of all, I would say that people of our age, like in our 30s, so we are responsible for our own health. So we have to make sure that we choose smart when we are eating. Uh, People who are into their teenage, so for their parents, I would like to say to their parents, because they are in their teens, so we have to help them understand that planning a meal or snack ahead of time is very, very important. When you know that what time you are going to study, what time you are having your classes, you can prepare your meal one time ahead, one day ahead, 1 hour ahead, that what I'm going to eat in this snacking time. Again, when we talk about our age people, so focus on nutrient dense food is very, very important. So when we come, let's say when we come from office, most of the time we tend to have unhealthy food at that time, especially when we are bachelors. So what happens that at that time we are very tired, we don't feel like cooking or eating. Okay, so at that time we tend to order something and we are tempted as well, hungry, so grab a quick thing. So we have to choose, we have to make sure that we choose a healthy food. So rather than going for a burger or pizza at that time when you're hungry, it's always better that you choose food such as vegetables, whole grains, lean meats, and low fat dairy products. These foods are packed with vitamins, minerals, and fiber, and that are very, very good for our body function. Now, when we say that, as you said, that not everywhere it is mentioned how much labeling is there, right? So, when we are, let's say, if we are ordering from the Swiggy, you can simply do one thing. There is something called as no more. Whenever I order something, or when I go out and I see the menu, I always look for something which is having the description of the meal, what is being used. If there is nothing, please call the waiter and ask what is there. If you're ordering food, Swiggy and Zomato have the briefing of what is being used in the food, so please order that which is having the description. So rather than you ordering a paneer butter masala or chicken butter masala with naan, it's always better that you can incorporate a lean meat salad. You can order a burrito, which is actually having boiled beans, vegetables, some amount of brown rice. Okay, and there's a good cheese. So cheese is also very good because it is high in protein and good fat. So these kind of option we can always choose. Whenever you are going out to eat, make sure that if you are ordering dal, rather than ordering dal tadka, you order a normal dal. You can ask the waiter to help you out with these things. It's very easy. Okay, snack smart. So whenever you are going for snacking, rather than having a packet of biscuit, it always good. Always carry a fruit in your bag. Whenever you're going out, always carry a fruit in your bag. And people who are at home, it's easy for you. Fruits should be there in your fridge. If you're feeling hungry, if you want to snacking, please have a fruit. If nothing, just cut a cucumber or carrot and have it. So that is how we can maintain, stay hydrated. A lot of times, especially in the summer, this time I'm like, the temperature are very high, it's 40 plus, right? So what happens a lot of times, the body requires water, but we tend to misunderstand it as a hunger, and we tend to eat. And at that time we eat mostly the fatty food or the sugary food. Rather, you just try this, drink water, see if you still feel hungry. Okay, and very, very important thing I would say ki water is something, hydration is something which is going to help you anyway, because 70% of the body is made up of water, and if we don't maintain that, we will fall. So taking as an example of a plant, I think, Kelvin, do you have a plant at home?
No, I don't have a plan.
Okay, so you must have seen plants somewhere, right? So if the plant is raw, like we are watering it every day, will you be able to break the branch?
No, we won't be able to break it if it's green.
Of course, you'll have to twist it, or you'll have to use a scissor or a knife to cut it. At the same time, if it is like, completely dry, no watering, nothing for few days, it is completely dry. You can break it easily, right?
Yes, definitely we can.
Same with our body. If you are hydrated, then 90% of the things which is going to affect you, be it as disorder, being a injury like you fall or you get your bones injured, or when we are talking about heart, so your heart is also like, when you don't drink water for a longer time, do you see the palpitation? When you walk for some time and if you're not drinking enough water, you can see the palpitation. You can see the palpitation up until here. You feel it, that it is palpitating very fast, just beside your neck, sorry, beside your ear, right? So that's why water is also very, very important. So I think these are the very basic things which we can take care while we are, having food, which can help us avoid any heart attack.
Okay, ma'am, that was quite informative. And a last question: as a dietitian, what are some of the common myths about diet and heart diseases that you have encountered in your career?
Okay, so one of the common myth which I have heard from the most of the people of my age and your age, Kelvin, I'm too young to worry about heart disease. Now people are getting heart attack at 32. What do you have to say now? Okay, so never take your health for granted. I know wealth is very, very important, but your real wealth is your health. You fall sick today, whatever earning you have done is not going to help you at all. Okay, so I understand that earning is important, but taking care of your health is also your priority. So while you are working, while you are eating food, you make sure that you like eat on time, and we have to make sure that we are doing some activities. Another thing is that I know if I had high blood pressure, because there would be warning signs. There won't be any warning sign if your blood pressure is high. High blood pressure is commonly known as silent killer, because you don't usually know if you have it. You are walking somewhere, or if you are walking in a train, sorry, you are going in to somewhere in a train or in a flight, suddenly your blood will pump up, blood pressure will go up. You will not know it, and you will get a heart attack. We have seen it recently. I read in the news that there was a um, old man. I definitely, he was old, but he was about his 59 to 60, and he was sitting, he had his food, he was okay, there was no problem. All of a sudden, when the flight landed, he died already. When? Nobody knew, because they thought that he's sleeping, because that's what, his blood pressure suddenly went up and he died in the plane. So we don't know, so we have to make sure that we keep on, your you should always check your blood pressure on a regular basis. Okay, I would not say every time, but definitely in the current situation when we are having a lot of pressure in professional and personal life, make sure that you're getting it checked every time, every 10 days, or at least once in 15 days. The next myth is that I'll know when I'm having a heart attack because I'll have a chest pain. Not necessary, because a chest pain will give you discomfort. So the people who are sleeping, of course, when you will have a chest pain, you will wake up, right? Then how come the people who are sleeping gets heart attack and they, they are gone in their sleep itself? The heart attack symptoms may be subtle as well. You never know that you are getting it. It can be a little bit like shortness of breath, nausea, feeling of lightheaded, a pain or discomfort in your arm, which you mostly tend which we may mostly tend to ignore. So I would like to tell you one point here, that when you feel, when you are stressed, when because of certain in event happens in life, you get anxious, right? We get worried about, let's say, worried about our loved one, or worried about our work, in pressure of completing a project on time. These all can create some kind of pressure on you and you feel anxious. Please notice, after Hearing this, please notice you will get some kind of discomfort in this part of your body, that is the left part. Starts from the finger, this middle finger of the left hand, it starts from here and starts getting some discomfort on the left hand side of your body. If you don't treat it immediately by having some water, or avoid just closing all the work and take a deep breath, it will increase. So these are the signs which we tend to avoid. Diabetes won't harm my heart as long as I take medicines. Treating diabetes can help reduce your risk or delay cardiovascular disease. But even when the blood sugars are under control, you are still at risk. There is a saying, once a diabetic, always a diabetic. I don't believe that once a diabetic, always a diabetic, but I do believe once a diabetic, always on the risk of other lifestyle disorder as well. Okay. Another part is heart disease runs in my family, so there's nothing I can do to prevent it. You can. Even if my family have diabetes, if I take care of my life because I know it. Okay, so when you are 10 plus, you understand that, okay, my father or my mother, or let's say my grandparents had diabetes or they were having heart issue, you know that you can take care of it by doing such kind of prevention. So prevention is always better than cure. You can always create an action plan. Get active, eat better, stop smoking or alcohol. In fact, don't get into a smoking and regular alcohol itself. Then another one is I don't need to have my cholesterol checked until I am middle aged. There's something called as COVID we all have gone through. I think that was in 2020. I was around 27 at that time, 26 or 27. But having a regular checkup is mandatory now. You see, any corporate company will get your whole body checkup done every year. So if you're not working in a company where you get an yearly checkup, why can't you do yourself? Get your checkup done, at least your cholesterol, diabetes, thyroid, the parameters which can actually leads to lifestyle disorder, get it checked every 6 months. Spending 2,000 on your body is not something which you can't do, right? Another one is heart failure means heart stops beating. No. Heart certainly stops beating during a cardiac arrest, not heart failure. That the heart, with heart failure, the heart keeps working, but it doesn't pump the blood. The lub dub will still happen. You can see the heartbeat, you can feel the heartbeat, but the blood, as we talked about in the early questions, that the blood pumps, which helps the nutrient reaches throughout the body, that doesn't happen. So that slowly becomes shortness of breath and then swelling in the feet or persistent coughing or wheezing. So some small symptoms will come. So another one is then pain in leg must be a sign of aging. I'm not sure if it is anything to do with your heart, or heart is beating really fast, I must be having a heart attack, or I should avoid exercising because I recently encountered a heart attack. These are the common myth which we have and which we heard, right? Nothing like that. You should exercise even if you have gone through a episode of heart attack. You should be more cautious now. If you feel that your heart is beating really fast, that could be because you are dehydrated. That could be also when you are having a fasting. That could be also because you are anxious on certain thing. When your legs are paining, it is not only because it is your, it's because of your age, or it's because that you're having some knee issue or joint issue. Please get it checked. Please don't avoid these signs. I think I would just want to rest here, Calvin, by just saying one thing, that getting yourself checked every 6 months is the best thing, best prevention for any of your health issue, be it heart, diabetes, thyroid, whatever. Because you get to know the culprit and you hack them till then before they make you die. Okay. Yeah.
Yeah, I think that was quite a strong ending that you gave over there. A strong message also that we need to
Thank you.
definitely consult an expert, you know, for all of these things rather than just relying on internet knowledge. And moreover, having a disciplined life, disciplined in the manner, planning things ahead. Even though we are busy, we need to find time to plan things ahead so that we can have a healthy lifestyle. And it's not like um, we are young and it's not going to affect us. We don't have to be afraid, but as you mentioned, we definitely have to take care of ourselves and get checkups done regularly. Right. So
Perfect.
that's summing up this session. Thank you with us once again. This is dietitian Garima Pallavi. Thank you, madam, for spending time
Thank
with
you.
us and sharing your knowledge with us.
Thank you. Thank you so much, Calvin. Thank you for having me here. Before we end this session, I just want to tell one thing that we have to make sure of five things in life, okay, to encounter any kind of disorders. Number one is that get yourself checked regularly. Number two is that eating regular, eating on time. Number three is little bit of activity after half an hour or 45 minutes of you having a good meal. Look, for example, breakfast, lunch, and dinner. After that, you should do a little bit of walking, or like at least stand. So, for example, if you're in office, do not sit on the chair, stand up and do the work, but be active so that you avoid certain things. Number four is little bit of strengthening is very, very important, because if we talk about early generation, the farming was the basic occupation for most of the people in India, right? So what they used to do, they used to lift heavy. That has been avoided in day to day life. What work we have? Laptop, headphone, like how I'm also looking right now. So make sure that other than this, you do certain activities which is involved in strengthening. And last but not the least, as I was talking about stress, is the main aspect of having any kind of health issue. Even if your four things which I told you right now is on check, if the fifth part is disturbing, the stress is disturbing you, we can cause health issue. So always make sure that if you are stressed and if you are finding yourself being anxious very regularly, please consult a psychologist. Talking to someone in your hard time is not bad. They can help you better, and especially talking to a stranger is much more healthier than talking to your friend, because they can give you something which is related to you only because they know you. A person who don't know you will give you unbiased suggestion. So that's all from my side. Also, thank you so much, Calvin and Heart Health India Foundation, for having me on board. I hope whatever knowledge sharing happened today help a lot of people to know what they have to do for their betterment. Thank you.
Thank you, ma'am. Thank you, ma'am, for your time. So with this, we are ending this session, ma'am. So
Yeah,
we'll contact you. I think we'll get in touch with you for probably more sessions if that's okay with you. And
sure,
we'll
sure.
be ping you up once we upload these videos, and we'll be making shorts, reels, and all. We'll ping you up once we have uploaded all of this. Sure, ma'am.
Sure. Thank
Sure.
you.
Thank you. Thanks a lot, ma'am. Bye bye.